day everyone, I'm Allyza Estorco and I'll start our presentation.
Our first topic is gene therapy. Basically, gene therapy is a modern technique that uses genes themselves to treat or prevent diseases. Instead of giving a pill or doing surgery, doctors try to solve the problem by targeting the root cause, which is the gene. So, paano ba ito ginagawa? Usually, scientists insert a healthy or normal gene into a patient's cell para palitan yung defective or mutated gene. May tatlong main approaches ang gene therapy. First, replacing a mutated gene. Halimbawa, kung may sira yung gene na nagdudulot ng disease, pinapalitan siya ng healthy version. Second, inactivating a malfunctioning gene. Minsan, may gene na sobrang activity niya at nagdudulot ng sakit. So they turn it off or silence it. And the last one is adding a new gene. Minsan, wala talagang gene ang tao na kailangan para labanan ang disease. So doctors insert a new one to help the body fight. One real-life example is sa genetic disorder na severe combined immunodeficiency or SCID, tinatawag ding bubble boy disease. Nagkaroon ng trials na successful. Naibalik ang immune system ng bata after gene therapy.
Gene therapy reminds us that science can give hope to patients who once had no options. It proves that with enough knowledge and innovations, we can change lives at pretty much level. Hi, I'm Ann Pengla, and now let's talk about stem cells and why they are so important.
Stem cells are very unique. Unlike other cells, stem cells have two specifically abilities. First, self-renewal. Kaya nilang gumawa ng sarili nilang copies almost unlimited. Second, differentiation. Kaya nilang mag-transform into other specialized cells like blood cells, muscle cells, and nerve cells. Think of stem cells as blank states or building blocks. They can become whatever the body needs. So, kapag may nasira na tissue or organ, ang stem cells are like the body's natural repair kit. Now, may 4 na levels or types of potency. First, totipotent. Ito yung pinaka-powerful dahil kaya nilang maging any type of cell, pati yung placenta. Example, zygote. Next, pluripotent. Kaya nilang maging halos lahat ng cell types sa katawan pero hindi na placenta. Example, embryonic stem cells. Next, multipotent. Limited na, pero kaya pa rin maging iba't ibang related cells. Example, blood stem cells that form red blood cells, white blood cells, and platelets. Last, unipotent. Ito yung pinaka-limited. Kaya lang maging one type of cell. Example, skin stem cells. Imagine parang video game character. Yung totipotent is like a character with max powers. Kaya niya lahat. Ngunit, habang bumababa, limited na yung abilities. Pero lahat sila may role sa katawan at sa medicine.
Stem cells remind us that our own bodies have hidden power science, we can unlock that potential and use it to fight serious
First, we have embryonic stem cells or ESCs. These come from early stage embryos, especially from a blastocyst, about 3 to 5 days old. ESCs are pluripotent, meaning they can become almost any cell in the body. They can grow indefinitely in the lab and can turn into many types of cells. So, sobrang useful sila for research and therapy. For example, scientists are studying ESCs for treating spinal cord injuries and diabetes. Mahirap silang i-control at i-culture. May chance na maging cancerous kung mali ang growth. And most importantly, ethical issues. Kasi, embryo ang source. Adult stem cells or ESCs. These are found in specific tissues like bone marrow, unlike embryonic stem cells. Limited lang sila, usually multipotent, meaning kaya nila maging several, pero not all, cell types. Bone marrow transplant. Doctor use blood stem cells to treat leukemia patients. Proven na ito at ginagamit na for decades.
Embryonic stem cells hold great potential, while adult stem cells are proven relatively. Both drugs can be seen forward.
Hello, I'm Jericho Bambico. Let's continue with more recent and practical types of stem cells.
The third type is induced pluripotent stem cells or iPSCs. Ito ay adult cells like skin or blood cells na nagre-reprogram using genetic engineering para bumalik sa pluripotent state. Parang rewind button. Balik sila sa stage na pwede ulit maging halos lahat ng cell types. The best part is, iPSCs can be made from the patient's own cells, less rejection risk. Why iPSCs are a game changer? Ang iPSCs ay isa sa mga pinaka-exciting na discovery sa stem cell research. Kasi imagine, galing siya sa mismong cells ng pasyente, kaya mas mababa ang risk na i-reject ng katawan. Hindi rin kailangan ng embryo kaya walang ethical issue. Dahil dito, nagiging possible na ang personalized treatment sa tissue repair na mas safe at mas makatao. Researchers use iPSCs to grow tissues for transplant experiments, study genetic diseases, test new drugs safely. They represent a future where doctors can repair damaged organs using a person's own cells. The fourth type is umbilical cord stem cells. These are collected from the cord blood after a baby is born. Hindi ka ng invasive procedure kasi kukunin lang after birth. Why cord blood is valuable? Mahalaga ang cord blood kasi may laman itong multipotent stem cells. Ibig sabihin, kaya nito maging iba't ibang uri ng blood at immune cells. Ang maganda pa, pwede itong i-freeze at i-store sa cord blood banks para magamit sa future. Advantages: multipotent, so they can become many cell types. They can be frozen and stored for years in cord blood banks. Less risk of immune rejection compared sa ibang stem cells.
iPSCs and umbilical cord stem cells prove that science keeps finding creative way to solve ethical issues while still saving lives. These discoveries often favor and more acceptable options for stem cell research.
Hi, I am Justin Bumatay. For our last topic, let's move to in vitro fertilization and surrogacy.
In vitro fertilization or IVF is one of the most common assisted reproductive technologies. The egg and sperm are combined outside the body in the lab tissue. Once fertilized, the embryo is placed into the woman's uterus to grow naturally. IVF is usually for couples na nahihirapan magkaanak. Reasons include blocked fallopian tubes, low sperm count, or unexplained infertility. Success rates vary, but IVF has helped millions of families worldwide. Surrogacy naman is when another woman carries the baby for someone else. This happens when the mother cannot safely carry a pregnancy due to health issues. There are two types. Number 1, traditionally surrogacy. The surrogate's own eggs is used. Number 2, gestational surrogacy. The egg and sperm come from the intended parents and the surrogate just carries the baby. Maraming sikat na personalities ang dumaan sa IVF at surrogacy. Chrissy Teigen and John Legend had children via IVF after years of fertility struggles. Kim Kardashian and Kanye West. Kim used a surrogate for her younger kids dahil risky na ang pregnancy niya. Priyanka Chopra and Nick Jonas had a baby via surrogacy in 2022. Even in the Philippines, may mga celebrities na nag-open up about IVF and surrogacy journeys, breaking the stigma.
In vitro fertilization and surrogacy proves that science is not just about laboratories, but about families and love. It shows how technology can make impossible possible, giving the gift to life to live it most.